Hello, I'm Sean Samwan Park. I'm a prosthetic urologist practicing in Seoul, South Korea. My main field is inflatable penile prosthesis. For the past a little over a decade, I have been dedicating my practice into this field. Recently, I went to Lubeck, Germany to attend the course of the Immersion in prosthetics, invented by my mentor, Dr. Stephen Carl Wilson. When it comes to surgical education, I think density is a very important thing. Just like the title says, Immersion course, we really immersed them in depth for 2 days in a dedicated long hours of the penile implant surgery. Didactic course is going on for about roughly in total of 12 hours. There are surgical videos and didactics we keep giving to the trainees, while there were 8 scheduled live surgeries where the 5 or 6 of the attendees will join and see the case and talk with the surgeon, and they come back to the didactic courses. I really was happy to join this course with Dr. Wilson and Dr. Daniel Osmanov in the Lubeck UKSH hospital, and Paulo Egidio from Brazil as proctors to run this course. I did 2 live cases with the attendees. By the way, the Lubeck UKSH has a great hospital. It was the most advanced and modernized surgical environment. It was a great 2 cases with their team. Their nurses were amazing, and everything was really lined up perfectly. The last memorable case was, and it was an emergency case. So this gentleman got the penile implant about 20 years ago. His age is currently 92 years old and got Alzheimer's disease about 7 years ago, and staying in an assisted facility. So since he was not able to void himself, they put the Foley catheter into his urethra rather than directly to the bladder, which should have been done. But the problem with him is that his ejection fraction, his heart function was lower than 30%. It was a very weak heart. So they were not able to give him any general anesthesia or spinal anesthesia. So that's why they had to put the Foley catheter to his urethra. And because of a long inflammation like that, then the urethra will become eroded. Because of the frictions, the penile implant also eroded through the urethra. So he was bleeding through his urethra, and it was a kind of emergency. Dr. Osmanov suggested me join the case because I mostly do the case on the local anesthesia. He was doing the dorsal block, and he was great. He was doing great. The only thing I added was some minor blocks to ease the pain. Case went surprisingly well. We took the problem implant out and closed the hole in the urethra, and everything went well. So he had no problem with his heart or whatsoever. He was wide awake all through the case. The gentleman was very happy with the surgical result they have. A good number of those patients who need a penile implant has comorbidities like heart conditions or diabetes or linear functions, various things. In a case like that, those who are having hard time for the general anesthesia or the troublesome, local anesthesia seems to be a very good option for them. It was a great honor and happiness to join the Immersion course and see how Dr. Wilson is training the others. For me, it was a great learning.